Well, Orbis Education is a leading provider of pre-licensure healthcare programs for colleges and universities all over the country. It started with 3 employees in 2003, has ballooned to more than 500 now, with more than 200 of those workers, the majority actually based here in Indianapolis. To meet growing demand, Orbis recently moved into a new state-of-the-art facility in central Indiana. And for details on the Orbis Education model, we turn to founder and CEO Dan Briggs. Dan, as always, welcome to the program.
Thank you, Gary. Really appreciate being here today.
I want to talk about some big news regarding growth, new headquarters as well, but begin by talking about the model. This is, in my opinion, a real Indiana success story. You founded the company in 2003 with an idea. Talk about what that business model is.
Yeah, so basically what we have looked at is, when we started the company, we're really looking at what is going on in the world from a healthcare workforce shortage issue. So what we did is we studied the market, looking at both the university side, which is the supply side, and then the healthcare side, which is the demand side. We decided that the best place for us to be was right at that intersection and figuring out how we could take the model and change it slightly. What we've done is created an online version of the didactic or the theory-based education, and then we form and set up educational sites, which has laboratories as well as skill centers, simulation centers. And then we also partner with with hospital systems across the country to really produce those nurses and make sure they get the bedside experience they're required to have.
So obviously the nursing shortage continues in a big way, and you layer on top of that, COVID testing, which has changed so many things as well. How's that all impacted business at Orbis?
Yeah, so from our standpoint, the business was going extremely well. This is going to amplify it even more. What we've seen with the shortage is some of your healthcare workers are starting to leave the profession. We've spoken to a lot of people, and they actually think that we will see a decrease in the number of people staying. That was not factored in when we were looking at total supply and demand shortages. So what we're going to see is with the COVID, you're going to see even higher demand on the healthcare professions, and we're going to see a greater demand for the type of services we offer to the universities.
Mentioned earlier a lot happening at Orbis Education. About a year and a half ago or so, you were acquired by Grand Canyon Education. You've also moved into new headquarters space and actually added 150 people right here in central Indiana.
Correct. Yes, so this was a great success story from its inception. One of the nice things is we had a lot of local investors from here in Indianapolis. We had a private equity round. Last year, in the beginning of 19, we were acquired by Grand Canyon Education. And, it's been one of those huge success stories that the acquisition has worked out extremely well. We've continued to add people. We've continued to add partnerships. Our client base has increased. We're currently sitting at 25 unique individual university partnerships. And by the end of 21, we will be at 40 separate locations across the United States. So it's really gone extremely well.
Yeah, a lot of growth. Where do you see things going forward in terms of the education space, especially as it relates to healthcare and fueling that healthcare workforce? Because there certainly seems to be no end in sight in demand in the healthcare sector.
Yeah, so one of the things we've done, which is very unique, is to allow students to educate more in place. So by having an online component, it allows for us to really kind of reverse the model a little bit and allow the student to be able to educate on their time. It's not on their time from the standpoint over long periods of time, but if they can do their work at a more convenient time for you, it gives us the freedom to then schedule things such as clinical rotations, laboratory times, at a time which is really available. So with our model today, it allows us to really kind of take advantage of the time that's available in the health systems. Secondly, with technology coming out today and the technology that's available to us right now versus 5 to 7 years ago, things like virtual reality, simulations, which can mimic a patient experience in a healthcare system. We've taken advantage of those, so we're seeing that the ability of technology to play in today's workforce, as well as having a company like us, that this is what we're focused on. We can operationalize these and bring them to the market much quicker, which helps both the university side as well as the healthcare system really see a supply which is better prepared for what they're going to do on the day-to-day job.
Dan Briggs is the founder and CEO at Orbis Education. Dan, thanks for joining us. Congratulations on really a lot of new developments and continued growth at Orbis. Appreciate it very much and look forward to seeing you soon.
Thank you, Gary. Thanks for having us on.
All right.